Good day, I'm Dr. Marlon Martinez. I'm a urologist with deep interest in male infertility. Azoospermia is the absence of sperm in the ejaculate. Sperm production or spermatogenesis is highly governed by the brain, the testes, and the reproductive tract. The hypothalamus secretes the gonadotropin-releasing hormone, which stimulates the pituitary gland to secrete hormones which are responsible for sperm production. These gonadotropins from the brain will stimulate the testes to produce testosterone, which eventually lead to sperm production. Any problem in the brain and the testes can lead to azoospermia. Sperm are produced within the testes. It will travel to the epididymis, vas deferens, and ejaculatory ducts. Azoospermia can be classified into two categories. It can be non-obstructive or obstructive azoospermia. It is very important to distinguish what type of azoospermia the patient has, whether it is non-obstructive or obstructive azoospermia, because they have different types of results, they differ in clinical presentation, they have different treatment options, and more importantly, they have different prognosis. These two types of azoospermia have different clinical profiles depending on several parameters. And these are the total testosterone, FSH, size of the testes, and other factors. For men with obstructive azoospermia, these are the treatment options. We can offer surgery in the form of removal of the obstruction, then reconnecting the pathway of the sperm. Hopefully, this will result to the flow of the sperm outside the male genitalia. Other option is to do sperm retrieval, which will be followed by assisted reproduction. Patient can decide to undergo bypass or removal of the obstruction in the epididymis, vas deferens, and ejaculatory duct. This process can lead to natural conception. Second option for men with obstructive azoospermia is to get the sperm directly within the testes or from the epididymis, and this will be used for assisted reproduction like IVF or ICSI. On the other hand, men with obstructive azoospermia secondary to testicular failure, there is only one treatment option, and that is to get the sperm directly from the testes. This procedure is called microdissection testicular sperm extraction or microtesi. In this procedure, we use an operating microscope. We do small incision at the testes and we look for dilated tubules which might contain the sperm. These dilated seminiferous tubules will be submitted to the embryologist. Once sperms are found, these will be cryopreserved and will be used for future IVF. In addition, it is very fundamental to distinguish obstructive from non-obstructive azoospermia because they have different sperm retrieval rate, or what are the chances of finding sperm if we do harvest. For patients with obstructive azoospermia, since they have normal sperm production, the only problem is the blockade along the reproductive tract. Sperm retrieval rate is around 95 to 100%. On the other hand, patients with non-obstructive azoospermia, sperm retrieval rate is only around 30 to 50%.